Welcome back. For the past 30 years, the rate of premature birth has risen steadily in the United States, and in 2003, the March of Dimes put itself on the front lines in an effort to confront this alarming trend.
It's launched the nation's first prematurity research center dedicated to solving the mystery of premature birth. So joining us today is Marilyn Knoll, who's with the March of Dimes. She is the Maternal and Child Health Program Director. Tell us, what is March of Dimes looking at now, and how are they trying to attack this problem?
Well, the March of Dimes is really on the forefront, of looking at this and attacking it from many different areas, because there's not just one solution. There's not a silver bullet that's going to take care of this. We need a broad approach. So we have research, as you mentioned, and that's one of the things that we do very well. We have 5 prematurity research centers here in the United States, and they're looking at it from many different areas. Genetics, they're looking at it from social economic type of things, environmental, what kinds of pollution is in the air that might be affecting this rate. There are a lot of different things they're looking at there. We do advocacy, so public policy. There's a lot of things to make sure that, like in healthcare, that they include what women need, pregnant women need for their health care. And so there's just, we also have programs. We do a lot of education for consumers and professionals. And here in Milwaukee, we are really, well, in all of Wisconsin, we're looking at really 3 particular things that we think will reduce prematurity. One is pregnancy intentionality and birth spacing that go together, smoking cessation, and then increasing the utilization of group prenatal care.
Let's start with the first item, and that is a matter of not just mothers who are already with child, already expecting that child, taking the steps necessary to improve their health, but this is planning a pregnancy.
Yes.
You want people to take that deliberate approach to having a planned pregnancy.
Exactly. I mean, a healthy woman can, has a healthy pregnancy, and if a person thinks about it and plans for it, then they can, if they are a smoker, perhaps quit smoking. If they're diabetic, start to really work on that. I mean, or if they're overweight, to try to reduce their weight. There are things that they can do to make their pregnancy outcome, the chance of it being more healthy. And so one of the things that we know here in the United States and in Milwaukee, that not all women have the same access to services,
right?
To healthcare, or even just knowledge. I mean, just the knowledge of what is available to you for contraception and what do you want, and then having it available to you when you want it. So it's really interesting. And then women also don't know how important it is to space their pregnancies, so that they can be healthy after they've had one birth. Wait 18 months before you get pregnant again, so your body has a chance to heal. If you have a close interval pregnancy, the chances of you having a preterm baby, it just skyrockets.
Really?
Yeah, and a lot of people just don't realize that. So this idea of planning not only the first pregnancy, but also planning your subsequent pregnancies.
Now, one of the things that Dr. Garrison talked about in the piece that we ran at the beginning of the show was looking at the disparaging numbers, especially with African-American women and women of other races. What is the March of Dimes doing here in Wisconsin to try to deal with that?
Well, partly bringing knowledge to it, and also looking that it's not just one thing again. But for us specifically, there's a program called Centering Pregnancy. It's a group prenatal care model. And it has been shown through research that it really reduces the rate of prematurity among all women, and specifically among African American women. So March of Dimes helped provide funding to get some centering pregnancy programs up here in Milwaukee, and our goal right now is to try to at least double the number of women and sites that are available, but that's, will take time to do that. Also, we have a program called Stork's Nest, which is prenatal education, and so where women come together in a group and they receive education. Women don't get the education that you would think they would get. A lot of people don't know these things. I mean, no one's ever told them. They go to the doctor and the visit's so fast. If they had a question, they might have forgotten it, or didn't get it answered. So the idea is to empower women, to know about, pregnancy and what it takes to have a healthy pregnancy, and also to try to let the community know as well, that during pregnancy, all women really need support, but pregnant women need support.
Marilyn, some of the things that we talked about obviously are within the control of the individual, of families, of women, and then some of them are not. And so something else that you're working on is research to find out about those situations where it's perhaps out of this expectant mother's control. Yeah, what else is going on?
Well, one of our prematurity research centers just recently, the one that's in Ohio, they did some studies, some genetic studies, and it was really quite interesting. They found that a lack of selenium which is one of the minerals that your body needs, seems to be, you know, associated with an increased risk of preterm. So you think, okay, well, what does that mean?
Right.
Yeah.
Woman taking her vitamins, or it may be the soil that the vegetables grow in doesn't have enough selenium. Or it may be that her body just doesn't absorb it. So we need to find out more, but it just may be the soil that things are grown in, or it's a food desert. She can't get the foods she needs that are healthy, things like that.
Wow, learning a lot.
Yes.
All right,
March of
Marilyn, thanks
Dimes.
so much for joining us today, and good luck as you continue this fight.
Thank you so much.